we're talking about what to do when your client asks you for your opinion. Even though we know we aren't supposed to give our personal opinion, it doesn't mean our clients won't ask us for them. So what the heck do we do? Well, we don't want to end up always giving our personal opinion and then telling the client what to do, because if we go down that path, then that's what they're going to expect of us, which is not our role. And on the other hand, if we never answer our clients' questions, they might get frustrated and feel like we're being evasive. So this is definitely a sticky situation for new health coaches that really does need to be navigated carefully. So today we're going to explore how to effectively handle this situation to strike a balance between offering insights and maintaining those professional boundaries. So I have 7 tips for you today on what to do when a client asks for your opinion. But before we get to the tips, I do want to make sure that we're on the same page when it comes to our role and the coaching process, which is absolutely client-centered. And that means that we assist our clients to use their own insights, their personal strengths and resources to set goals, to commit to action steps, and establish accountability to build their healthy lifestyles. We honor that the client is naturally creative, resourceful, and whole, and they are the experts on their own lives. We don't direct, we don't consult, or advise. So the bottom line is that our personal opinion doesn't really matter, and it isn't part of our role as coaches. We essentially take ourselves out of the equation. We're there to serve, guide, and facilitate a coaching process for our clients. They are the experts, they have the answers. And while all of this is true and known to us, our clients might not be aware or fully understand our role. They're used to going to medical professionals and getting professional opinions, advice, diagnoses, prescriptions, and treatment plans. So they might come to you looking for similar things. So let's start with what our clients might ask us that could be looking for our opinion. It might sound something like this. What do you think I should do? What would you do in this situation? What would you do if you were me? What advice do you have? What did you do to overcome this? And of course, they might simply just ask, what's your opinion on X, Y, or Z, right? And so we're stuck in this situation where on the one hand, we do want to give the client what they want. We want to provide value. And on the other hand, we do want to maintain our professional boundaries and stick to our scope of practice and our role. So what can we do about this sticky coaching situation? I've got 7 tips for you to handle the situation when you're asked for your opinion. Number 1 is to establish boundaries from the start. Setting clear boundaries is really fundamental to maintaining a professional relationship with your client. You'll want to communicate clearly the nature of your role as a health coach on your very first call, and then reinforce everything in a written agreement that both of you are going to sign. I also then like to review everything again on our first official coaching session. You're going to want to emphasize that your primary focus is on providing support and guidance, and that you facilitate a behavioral change coaching process rather than giving personal opinions. This upfront communication can really prevent misunderstandings down the line. So tip number 2 is to practice active listening. So when your client asks for your opinion, it's essential to truly understand the reasons behind their request. Practice active listening to really grasp their concerns, their motivations, and their expectations by demonstrating empathy and understanding. You'll create a supportive environment that encourages that open communication. Tip number 3 is to reflect, reframe, and redirect. So instead of offering a direct opinion, consider reflecting back what you heard the client inquire about and then reframe the question to guide them toward their own self-reflection. Encourage them to explore their own knowledge, their thoughts, and preferences related to this topic. Say something like, what do you know about meditation? Have you done any research? What have you heard? And then redirect them by asking open-ended questions that are going to empower them to make informed decisions based on their unique circumstances. You might say or ask, what do you feel like you want to do with what you know about meditation? What would you like to try? Tip number 4 is to share general information. If the client is really stuck and has no self-knowledge, resources, or information to draw upon, you can definitely ask permission to share general information or education and facts from evidence-based sources or from nationally recognized authorities that can really help your client make informed choices. This approach is going to ensure that your guidance aligns with established health principles and really does minimize the risk of imposing your own personal biases on your client. Tip number 5 is to highlight bioindividuality. If your client asks what you've done or what worked best for you, remind them that there's no one-size-fits-all approach, that health and wellness is very individualized. What works for one person may not work for the other due to varying lifestyle preferences and health conditions. So encourage your clients to explore different options and find strategies that resonate with their unique needs and their unique goals. Tip number 6 is to co-create SMART goals. If and when your client asks for your opinion, it's an opportunity to collaborate on goal setting. So discuss your client's objectives, their vision, their ideal state, and work together to develop a personalized SMART plan that aligns with their aspirations, preferences, and their lifestyle in a supportive way. And tip number 7 is to refer out. If your client's questions fall outside your scope of practice and could be addressed by another professional, it might be appropriate to refer out. This is a big part of our role since health coaching actually has a fairly limited scope. So referring clients to registered dietitians, physicians, mental health specialists is going to ensure that they receive the care and advice that's tailored to their specific needs. So to wrap up, while we know that we're not supposed to give our opinion to our clients, they still might ask us. Navigating the sticky coaching situation requires a delicate balance between providing guidance and respecting our professional boundaries. You can do this by establishing clear expectations, practicing active listening, reflecting and redirecting, sharing general information, emphasizing bioindividuality, co-creating SMART goals, and referring out when necessary. With these 7 tips in mind, you can effectively support your clients while maintaining the integrity of your role. Thanks so much for tuning in today. Please let me know if you have any questions at all in the comments. See you next time. Bye for now.